Good Saturday to everyone. It is May 9th, the day before Mother's Day. A nice Saturday outside, if not breezy and cold. Did a lot of yard work today, mended some fences, dug some post holes, picked up a lot of sticks at our house. Hopefully you got outside as well. Let me take you right to our testing results so far. We have collected 3,127 specimens. We've received 2,553 negative results, 398 positive, and 32 indeterminate, and our rate is down to 13.3%, and the state is at 20.6. In Worcester County, a total of 7,410 cases, and in Franklin County up to 289. At Haywood Hospital, we have 3 patients who are positive with the coronavirus and 4 patients who are under investigation right now. So as you know, that means we're waiting for their test results to come back. With this, there's this report, there is also a graph showing you the rates in the Worcester area for the Worcester and Worcester County area hospitals. So you can see a downward trend on the inpatient side. We peaked a little bit earlier than the overall county, but you can see that we seem to be trending downward, and that's all to your great work with your social distancing and your great hygiene and just making sure that we're doing all the right things, because remember, this is a long, long marathon for us. So appreciate the work everybody's doing. Just some raffle winners to report as we are in the midst of hospital and nursing week. Catherine Haney from Haywood Healthcare, Real Heroes Wear Scrub shirt. Joanne Fox, Haywood bag. Michael Suziak from Athol, Real Heroes Wear Scrub shirts, so some swag for folks. And then just there's a photo of our EVS team, and just a special thanks to members of our family who are often the unsung heroes. And so our board chair, Bob Chauvin, and my father-in-law, Bob Chambers, chipped in and got them all Haywood swag so they can look really sharp out there and show their pride in our organization. So thank you to the 2 Bobs, and congratulations to the EVS staff for your great new look, and thanks for the great photo that's with this video as well. I want to close today with a note from Dr. David Havlin. As you know, Dr. Havlin is one of the deans of our medical staff and has practiced for over 40 years in our community. And he contracted COVID-19 and spent a long time at Haywood in our ICU in particular. And so he has a nice note that he's asked me to read to all of you entitled, "Good Job." In April, I came down with COVID-19. For a week, I was able to stay home, but my symptoms progressed and I went to the ER. There, I had full lab and chest x-ray workup and then was admitted to the Haywood Hospital ICU. I cannot find words to express my gratitude and admiration for the staff that cared for me. The nurses, the nurse aides in the ICU and Watkins 1, with whom I've worked for many years. The respiratory therapists, the housekeepers, maintenance and security staff, the phlebotomists, and their 5 a.m. blood draws. The radiology staff doing their portable imaging, x-rays, and venous ultrasound, and then a CT chest when things got worse. Physical therapy for gait assessments, materials manager, Director Scott Janssens for providing PPE coverage in the ICU, ER, and the rest of the hospital. Nutrition services in the kitchen, providing me with good food and nutrition. How many mighty shakes did I actually have? To my cardiology colleagues and Jeannie Sanborn of infection control waving through the window in the ICU, I thank you. To my friends and colleagues outside the hospital for your messages, your texts, your thoughts, your prayers, your long distance Reiki from Winchendon and from Kolkata, I thank you. To administration for providing the necessary support for the excellent care teams, I thank you. To my colleagues, Dr. Tricia Vorderstrass for covering Baldwinville Nursing Home in my absence, and Dr. John Warden for taking over the consulting role for Broadview Assisted Living, I thank you as well. To my fellow staff at Winchendon Health Center, Dr. Berkowitz, Dr. Ada Kalam, Carol Reich, NP, and especially Elliot Nodelson, PA, for continuing to care for our patients via phone and telemedicine, I thank you. to my treating physicians, Dr. Ray, Dr. Malik, Dr. Mirza, Dr. Mohan, and especially my friend and colleague, Dr. KP, for caring for me and instructing me on proning, helping me keep the COVID-19 pneumonia from progressing. I cannot thank you enough. The ICU, through Dr. KP's dedication, skill, and knowledge, is second to none for a community hospital. And most of all, to my wife, 2 daughters, 3 sons, and their significant others, for your unending support through texts, calls, Zoom meetings. I cannot say in words what my heart feels. You kept me focused on recovering and following doctor's orders, something that's not easy for one who has practiced medicine for 40 years. Finally, it is with tears of gratitude I was taken by wheelchair from Watkins 1, down the elevator to the hallway of the ambulance bay where my son waited for me. The song Good Job by Alicia Keys played overhead as the hospital staff lined the hallways, applauding as I made my way home. Thank you to all. Good job. This pandemic has forever changed our lives. After I recover, I will return to medicine. I will take care of you. Stay safe and follow all the recommended guidelines. Dr. David Havlin. So thank you very much, Dr. Havlin, for everything you've done for us and for everything everyone's doing to keep us on our journey to be one of the best community-owned health systems in America. Have a great evening.